Preventative care, diagnostic testing, and early detection for dental disease. That's tonight's topic because so much of this is interwoven and affecting people like me, your average patient. And so I'm going to start off with you, Melanie, to ask you, when it comes to things that are happening in this industry and the perspective that you're hearing through the ADA and other things, and the focus on oral wellness and preventing teeth decay, what comes to mind when you just think about that?
Yeah, I think right now it's kind of a hot topic. Well, it probably always has been, but you have a lot of people, especially with the new fluoridation, some people taking it out of their waters right now. There's a lot of states fighting about this. So I think it's a lot of conflicting arguments. A lot of people are getting, news from TikTok or other sources where the ADA stance is a little bit different. And it's hard. I think the best thing we can do is just educate to everything that we know, but also understand that people are going to find their own information, probably going to believe information, and just, it's unfortunate. It's just one of those things that when they come in and they ask questions about it, just being as prepared as possible to say, this is what I learned in school. This is what the ADA recommends. Don't have to take it word for word, but this is just how we practice in our office. So I feel like it's, a tricky spot that we're in right now.
I could imagine. Well, John, what about for you? Because you've been around a little bit longer than Melanie. What kind of shifts have you seen throughout your career in regards to how oral wellness and dental decay is being taken care of?
It's interesting. One thing I want to add to what Melanie said was, because I write, it's amazing to me sometimes there's a kind of a weird thing about if it's written down and you read it, it seems more truthful, or it seems, more right. And that's not always the case, unfortunately, and especially now where anybody can write almost anything they want. Rightly or wrongly, they can write about, an anecdote or a personal experience. And, one of the jokes I love is, well, one time I was reading a book and I fell down the stairs. So that's what reading books does for you. So we've got to deal with that. And the massive amount of social media and other kinds of information that's out there is huge. I think we've seen a shift in some ways, at least in some areas, with the way decay is in areas where there's fluoridation. You don't see great big teeth, or maybe not nearly as common. I used to big teeth, with huge holes in them. I do still see that occasionally, but it's much more trying to be as diagnostic, at least with decay, as diagnostic as you can from an early intervention phase. I think all of us would rather catch things when they're tiny, than have to fix something, when it's a huge problem. And now we're starting to see things like genetic testing and salivary diagnostics. Those things weren't even talked about. When I was in school, I had analog charts and film. So yeah, it's come a really long way in the time that I've been practicing.
But you also brought up social media. And Kelly, maybe wasn't Kanye wearing some type of grill or something? What
Oh.
the impact is that gonna be when
I
you
can't
have a
even, I mean,
superstar?
how do you even clean that? How do you even clean around it? As a hygienist, I'm going, I don't want to see under it. I mean, imagine maintaining that. Talk about prevention. But John, you took the words out of my mouth with the salivary diagnostics, all the types of bugs and predispositions that it's allowing for us to kind of peek under the hood to say, what are these inflammatory markers? What are the keystone pathogens that may be prevalent in this environment? What are some of the other inflammatory markers in the body? And I really see, we've been talking about this forever, I know, in the hygiene world, and I'm sure this is not new for you guys, but customized medicine, oral medicine for the patient. I went to my functional medicine doctor last month and got all these tests run just to see how I was operating at age 50 and like what's my body doing that it wasn't before, and where I'm as a baseline as I am getting younger and leveling up. But I think that that's going to be a new standard of, where are folks at the baseline? How do we care for them? People, I think, will will begin to expect that customization. And then also too, as we develop more tools and diagnostic tools, because I know that we're going to, really talk about this and dig into it, but what are the devices that are allowing us to take a peek under the hood now that operate efficiently, give us efficiency, and give us that workflow that don't just give us one solution, but give us many. So I said a lot of things, but I'm excited to hear this conversation with my colleagues.
But Chad, I'm gonna ask you then, some of the devices that Kelly is referring to. Can you elaborate on that for her? For me, for the non-dental person in the room.
I wasn't really listening. No, I'm teasing. I'm teasing. No, I actually want to go a little bit of a different direction from what Kelly said. Take some of the things she said and just elaborate a little bit further. I think that she was hitting upon that we have so many diagnostic tools available to us. And one of the biggest problems is that we don't know how to use all of the tools that are available to us. And a lot of us don't use half of the tools that are available to us. I love that she hit on salivary testing, and John had mentioned it as well. And it seems like we're really focused on decay, but we have so many tools before us, and decay is really, yes, it's a huge problem in dentistry, but we have tools that can help us determine a patient's their likelihood of developing oral related cancer down the road, and other issues within the gut and the body. And we know that the gut drives the body, and there's so many tools that we have available to us for that. We also need to be cognizant of sleep related disorders, and we're starting to see patients that I've been seeing in my practice, this type of patient, for the past 25 plus years. And you're like seeing it, and now it's all of a sudden the lights are starting to go off. Oh my gosh, this child is suffering from a high vaulted palate, and this kid can't breathe. And you see adults that are morbidly obese, and the first question you ask is, are you having trouble sleeping at night? So we need to take prevention to a whole other level and stop looking just at the mouth, but looking at the overall body and the structures of their orofacial region that are either a result or an impact on their whole body health.
And Rick, do you want to weigh in on that conversation?
Oh, I think Chad really hit it on the head, because there's so many parents that see developmental issues with their children. And at least where Melanie and I practice, there's some really good pediatric dentists that are starting to detect this really early. And they're telling parents to have their kids checked early. So there's certain signs, excessive drooling, droopy eyes, large palate or small palate, large tonsils, and they're leading to ADHD and all these other issues. And then kids are developing sleep apnea at an early age. They're snoring, they're not paying attention, and there's simple things that can be done at an early age to help prevent future problems. And I think I don't know if it's just all of a sudden happening or if it's just the way that we're developing and evolving as humans. But I think that parents, really shortly after their children are born should start detecting or being aware of things early on. I think that's a huge thing that a lot of dentists are probably missing because we just don't know.
I think it's probably pretty true. And, you bring up some interesting points because I never really think about, gosh, I think about Botox maybe, or something that's coming up in the dental practices that I'm like, I can get my wrinkles taken care of and my mouth. But, I guess I really, as a patient, haven't thought, other than when they're checking your tongue for cancer or lesions, all the other things that you just named, Rick, because I would presume for a lot of parents, they probably are not registering that, wait a second, dentists have value for more than just the mouth, but to be able to be early identifiers like their pediatricians.
Yeah.
So, interesting point.
And when we're able to find these contributing factors, it helps us to educate the parents and put the emphasis on the need for care that can correct these issues that we're seeing. And, seem to be talking about children, but let them lead a better life than they're potentially headed for at an earlier age.
Mhm.
I was talking today to my senior students met, and we had a guest speaker in speaking about myofunctional therapy. And this is one of the points that I was going to bring out tonight in terms of prevention. So I'm pleased that we're talking about this. So 20, however many years ago, 27 years ago, when I started learning about the facial structure, the airway, all of that, you can't unsee it. I think I've talked about that on a previous episode. But then when you start to really look at it, you really can't unsee it because you start to see occlusal dysfunction, and you start to say, why is the narrow, is there narrowing in the arch? And then you start to see all the children with the ADHD, and then way back when, people would look at you like you were crazy, but it's like, no, it's all interrelated. So I think what's important here as we advance our understanding is that we also advance the connection of the interprofessional connection to all of us, and get those referral sources strong among your community, and say, who is studying swallowing, who is looking at this, who is looking at adenoids, who's that person that I look to who will care for these patients once it's beyond your scope. If you don't know, or if you want a second opinion, whatever that looks like for you. But to me, I think it's another arm of what we can do and where we can go with this.
Well, one question I have is, when it comes to even decisions that are made in a practice as to whether you are going to charge me a lot of money for filling a cavity or preventing a cavity, restoring a cavity. Is there any, and I know you're going to tell me, no, Lisa, it's whatever's in the best interest for that patient. But for some practices and some people out there I've heard the stories as a recruiter. I've heard the stories of staff being, hey, the dentist bought the building, we're not getting enough patients in, there's a lot of pressure for upselling. So financial pressures is an issue for some folks. But is there ever, in making what treatment decision, whether to repair or remove, do you think that happens in practices? Boy, they all get silent, Kelly, huh?
I would say that you put 100 dentists in a room and you throw some slides up on the screen with diagnostic data and images, I would say you'll probably get 50 different treatment plans. But there's a lot of reasons for that. Money might be one, but the majority of dentists that I know don't function like that. It's just that there's a lot of different ways to do things. Somebody might say orthodontics. Somebody else might say, but I could straighten these, misshapen and misaligned anteriors, in 2 weeks with, doing veneers type of a situation. So there's a lot of that. There's a lot of opinions. I mean, heck, the whole expression in the medical community, second opinion, came because somebody decided, you know what, I'd like another set of eyes to take a look at this. One of the things that I think, tying back to this whole body thing, is that I'll ask Rick and Chad. I feel like in the time that we've all been practicing, it's got to be at least within 5-10 years of each other. When I came out of school, a lot of people said the thing of, oh, you're just a dentist. You know, like somebody introduced me as doctor, not that I really care too much about that, but they were like, oh, you know, whatever, you dermatologist. No, I'm a dentist. And they go, oh, you're just a dentist. And I don't know the last time I heard somebody say that. And I think that the public perception of what we do has been elevated a lot in the time since I graduated. But one of the things I think that kind of holds the whole body back thing is way back in the dark ages when physicians and surgeons split off and went on their own. You know, at one point in time in medical care history, there was physicians and surgeons, barbers and dentists, and they were all the same person. And at one point, physicians and surgeons split off, and then a few years later, dentistry split off. But I think if there was really any logic to the way healthcare works, everybody would be, we'd all be accredited MDs with a dental specialty. And I would like to see that happen at some point where dentistry becomes, you get your medical degree, and then if you want to be a thoracic surgeon, then you go to a thoracic surgery residency. You want to be a dentist, you go to a dental residency. But the whole body connection is huge here. The mouth is a part of the body. The head and neck is part of the body. And I think a lot of people don't realize too, and then I'll get off my soapbox, but I'll never forget in my second semester of dental school, I was in head and neck anatomy. And we'd already taken the first semester of gross anatomy. And at the end of January, our professor said, congratulations, you all now know as much about the head and neck as any physician graduating from a medical school here in the United States. Now let's spend 12 more weeks. And crickets.
Mic drop.
I don't know what that was.
No, I think I just want to piggyback on what you had asked, John. I think that there will always be abuse of knowledge to a certain extent, unfortunately, in almost every profession, whether it's dentistry, whether it's medicine, whether it's whatever. And one of the biggest fears that I have is through one of the biggest tools that we have in our practice, which is AI. I worry that some people may use some of the results that they're seeing in AI to allow them to be a little bit more aggressive in their practice. Whereas with me, it helps me to be more preventive in our practice, with what we're seeing through AI. And it's all in how you use the tools that are available to you. And so it's unfortunate, but I think that there will be, some overtreatment, maybe if that's what you were asking. And, and John hit the nail on the head when he said that, you're going to have 100 different ways to do something if you put 100 different people in a room. And I think that the best thing that we can do is learn from others' successes and others' failures with the tools that we have before us and become better clinicians.
I would kind of piggyback on that, Chad, and just say that, like if you went to somebody and you said, do you have a system for going to the grocery store and shopping for groceries? And I think most people would say, oh yeah, I've got a system. I get the milk first, then I go to produce or whatever, but that doesn't mean that it's the wrong way to do it. It's just there's a lot of things like that in life. It's just when it gets down to healthcare, we try and make it as cohesive as possible. But I mean, Rick's right. Anytime you have knowledge, whether it's the person that fixes your car, the plumber, the electrician, there's always going to be people that will try and abuse this system.
That's so true. So Melanie, because you are closer to when you went through your training than the people on this call, what are your thoughts on it? You know, so you don't have the history of the trends and things over decades that they may have, but as you're coming out, you know, earlier on in the field, what do you think of this conversation?
Yeah, I think being newer, it's also I don't want to overtreat to seem like I'm doing more because I want to make money. I'm trying to show patients kind of the same mentality we have in our office, like a little bit more conservative. But what I do with anything, if you need a filling, if you don't need a filling, if we want to watch it, just telling the patient all the options that are out. I mean, within reason, all the options that I would think and giving the pros and cons. I think just clear understanding by the patient for them to make their own decision at the end of the day, obviously giving recommendations, but I'm not going to force anyone's hand, and I also don't want to scare them to death. It's just saying, here's what your issue looks like. Here's what we can do. Here's what we can't do. Here's the pros and the cons of both of them. If you have questions, I'm here to answer them. But just kind of just having them be as informed as possible. Then I feel like it's more up to them to kind of say, oh, I understand why we would do this, and I understand why we would do that. And then when they decide, it's them deciding. It's not me saying you absolutely need to do this. And then I feel like that just increases trust even more.
And I
Well
think
said.
go ahead, John.
No, I just said, well said. I thought that was wonderful.
And so I do think that, you know, I want to revert back to what Chad was bringing up, which was AI.
hmm
And, you know, I think, yes, we're always going to need dentists, but, you know, there's so many aspects, at least as a dental recruiter, where I'm being replaced. I mean, we can't do, I mean, I personally am Googling ChatGPT and, you know, whether it's language for recruiting, job descriptions, whatnot, there are things that I am not as eloquent as AI is. So it will be interesting to see as we go forth, particularly when it comes to, you know, the wellness, you know, and prevention as to where that takes us. I mean, Rick, do you have any concern? I have I just think, well, I know I'll be out of a job, but I don't think you guys will be. But do you have any concerns though as to where this is going with AI?
Well, I think every one of our discussions or episodes will always have some AI component because it's such a big thing with every job. But I'm not as concerned only because I have a lot of faith in our profession. I think it's going to be a bigger adjunct. I think it's going to help in detection and just helping us see things that we might be missing. So I think one of the hardest things, especially as a young dentist like Melanie, and this was so hard for me early on, and it's still not something that any one of us, I think, can say that we're totally 100% proficient in, is like just detecting caries and cavities on x-rays. You know, we all like to think we look at every x-ray like with a fine-tooth comb, but then 6 or 12 months later, a patient comes in with something, we look back at the radiograph and we're like, oh my God, how could we miss that? I think that's happened to every one of us at some point, hopefully not that often, but you know, I'm embarrassed to say it's happened more than I'd like it to, and I try to always be careful, but I think that's where AI can really help. And just that one example, there's so many other things. I don't think they're going to take over what we're doing physically with our hands, but it's going to help us catch things that we might be missing.
Very well said.
One of the things, can I add something to that, Lisa? On
Please.
that is just that studies have shown that the human eye, depending on the individual, perceives between like 30 and about 120 shades of gray. Computers right now can recognize 4.8 million shades of gray. And what that allows the systems to do is to sometimes see things that we don't see or that we won't see until they're worse. And, you know, it's an amazing tool with that, because I really feel that if you're preventively oriented, it's going to give you more things to keep an eye on, more things to recommend diet changes, fluoride treatments, high fluoride toothpaste for caries susceptible individuals. And especially if we compare that with things like genetic screening and salivary diagnostics to get a really full picture, maybe we won't have as many problems to fix, or there'll be different small problems.
Well, I want to give you guys a chance to have some closing comments. Kelly, as our dietitian a new career, her retirement career may go to being a dietitian.
I'm a dietitian now.
Oral wellness. I'm sure you're doing some nutritional work there as a dental
Yeah.
hygienist, but
Well, as I was thinking about what everyone's saying, the common thread through everything is trust, right? Our patients trust us to tell them what we see. And I think a big part of this is allowing them to visualize it up on the screen, whether it's on the radiograph with certain AI, whether it's with digital photos, whether it's a 3D scan, whatever that is, so they can lay their eyes on it, because that seeing is believing. And I think at the base of it all, of course, pharmacy is like the most trusted profession. I don't know if you guys knew that, but pharmacy is the most trusted profession. I guess we kind of have to do that. But I think that we are a trusted profession as well. And that above all, we do no harm, right? And if our patients know that about us, that we are there for them, to treat them with justice and to treat them equally, and we would do the same thing that we would tell our mother that we would want to have done for them, because they know they're there for that reason. All these tools and all these other diagnostic things kind of help build the case to build that trust as well. And I think too, I'll say one more thing on the AI, because I know we're wrapping up, but with the AI, I think it helps us prevent malpractice. I think that is going
Mhm.
to close the gap on that, because it is picking up on other things. So I think that we need to continue to watch that and to just check ourselves and to make sure that that we're not relying on it fully, which I don't know that we ever would. I mean, because gosh, as we said before, which dentist actually agreed on something ever? Sorry, Dennis, but I mean, with love, but you would take 4 bite wings and they're like, that's there. No, it's not. Yes, it is. This needs this. And then it's $10,000 difference between all you guys, with love. I'm kidding. That was an exaggeration, but I'm just saying that, there's different variation in all of our educational training and our background, but that's the beauty of it too, is that the AI can't see that because of the training that we've had and the
Mhm.
experiences that we've had. So I'm excited to see what the future holds.
so true. How about you, Chad? Any closing comments from you?
Melanie said something that she learned from her dad earlier that I think is just really, really key to all of this. And she said that, we're a relatively conservative practice. And so, I think that that sometimes we're almost conservative to a fault. And I feel that I'm the same way. But the one thing that I will tell you is that being conservative, it may be a slower start, but it will be a more fruitful finish. And I
Mhm.
think that we all need to realize that in our practices, that, you know, um, we need to always be conservative in our approach, but, we also need to be mindful of all the other things that could be going on with these patients, and use that conservative approach to take in all the data and educate those patients. And then as Kelly said, that just creates trust. When we communicate effectively, when we educate, it creates the loyalty and the trust from our patients, and that's what we want for our profession.
And how about for you, Melanie? Your thoughts?
Yeah, I think that the biggest two things, just totally going off of that, trust and communication. When I did residency, we had a huge whiteboard, and the only thing on the whiteboard all year was communication. And our attending would just, anytime we were talking about anything, somehow would bring it back and just point to the board, because he was like, this is all of dentistry, and this is all of kind of life. He's like, every problem typically is a problem of communication. So I think just always communicating with patients, good or bad, and that's what kind of that's what makes dentistry fun and enjoyable and everything. Yeah.
Very cool. How about you, John? Closing thoughts?
Yeah, I would say two things. The tech is great. I think AI is going to be an amazing thing in our industry. But I've never wanted to hug a computer. I've never wanted to, hold hands with a database. But I've hugged a lot of people in my life, and that's really the difference, is that people care. I'll close with a quote from a guy who is a dear friend of mine and a mentor. It's Dr. Dan Fisher, the guy that started Ultradent. And he told me one time, because I just used the daughter test. And Kelly mentioned, your mom. He just told me, he said, I just tell patients I would or I would not do this treatment on my daughter. And yeah, I think if you approach things like that, be nice, show respect, everything else falls in line.
So true. And how about you, Rick? Closing thoughts?
I think they all really said it all. And I think the key is just treat people like you're the people you care about the most. And if you really live those rules and, being conservative, just don't be neglectful, and just try to give the patients the care that you'd want the people you care about the most to receive. And if you really believe you're doing that, I think you're going to be so much more successful in every possible way. You can't always help mistakes. You try to limit them, but just really treat the patients, communicate, talk to them. The biggest benefit I think I had early on is I wasn't busy. I had like months and years where I just had like 4 patients, and I cherished that time because I could spend an hour and a half, 2 hours talking to the patient, listening to everything they said. And it really helped me in the future to really like try to be a good listener. And I think that's the key. And it's hard when you get busy, but you really can't step away from just talking, communicating, listening to the patient, and just really knowing what they're saying and giving them, the best you can.
And it's funny that you bring that up, because, my closing thought was that on all of these calls, but even particularly this evening, just as Melanie had said, it's about communication. You guys listen to each other so well on these calls, and that even just piggybacking on the previous person's comments, that, it just makes me realize that, except for Kelly, when she is doing direct service and her hands are in people's mouths where they can't talk back to her, like the waitress who's going to ask you, is everything okay when your mouth is full and you can't communicate? But we won't go there, Kelly. But the whole issue of the communication, how we watch you treat and interact with each other on these calls, to me, is probably how you're doing this in your practices and your personal life. And I think, Rick, I agree with you. I mean, it's so much of how, being a dentist, yes, you have great skills, but it's the relationship and being able to listen to the patients. And whether it's, I can't afford that type of treatment, or I'm afraid, or, the being able to, reassure them, as Melanie had referred to, it just shows that, yeah, listening is a skill, and a skill that we are practicing, and we got to continue to pay attention to. So thank you all for coming, this evening, and really enjoyed again a chance to have a seat at the table.